Hi, my name's Georgia from BN Australia, and today we're going to go through how to use the pelvic floor wand to release the deeper layer of the pelvic floor. So the pelvic floor has two main layers. One is an entrance layer around the entrance of the vagina and the entrance of the anus, and they are a closing muscle. So when they contract and tighten, they close the entrance of the vagina or they close the entrance of the anus. The rest of the pelvic floor is located deep in the pelvic bowl, so what I'm sitting on right now, and that is inside the vaginal canal, and when it contracts, it lifts up. So a lot of the time we hold tension and tightness in this deep layer of the pelvic floor, which can give you symptoms of bladder urgency, constipation, pain with intercourse, particularly deep pain, and it's really common in people with things like endometriosis, adenomyosis, bladder pain syndrome, etc. So with the pelvic floor wand, start if you're just starting out with the pelvic floor wand using the rounded tip instead of the more pointy tip. You're going to get into a reclined position, so lying on your back, and the wand is going to be lubricated up from the tip all the way to the neck of the wand with a water-based lubricant or intimate gel. We're going to gently insert it into the entrance of the vagina, so you're just guiding it in, and then this other end becomes your handle. So we're holding it at the handle end, and then the wand is inside the pelvic floor, or the vaginal canal rather, on the pelvic floor. Now, if you're lying down like this and you move the wand like this, you're not actually going to be on the pelvic floor. So we then need to pull the wand up towards your belly button and then turn it to the side in order to start getting on those muscles of the pelvic floor. A lot of people will have tension on the lateral side, so the outside parts of the pelvic floor, and so in order to reach them, we need to turn the wand acutely to the side, so we're really angling it to the side, and then we need to pull it up towards the belly button to get that pressure on the pelvic floor. When you've then got pressure or you found a tender spot and you're holding it there, take a couple of really deep diaphragmatic breaths in and out, so breathing in through the nose, out through the mouth, expanding the belly on the inhale, letting it fall on the exhale until that tension has dissipated. If it doesn't go away within 30 seconds, you could then try gently contracting and relaxing the pelvic floor to create a little bit more and then a little bit less pressure. Once that's kind of settled or dissipated somewhat, then you move on to the next spot in the pelvic floor, and again you can utilize the same techniques. To get to the other side, you literally just turn the wand all the way around to the other side. So we're now on an angle in the opposite direction, and remember we need to pull it up towards the belly or towards the belly button in order to get on that layer of the pelvic floor. I would initially try it in a reclined position, or you can also do it sitting up against a wall with your knees out to the side in order to reach those back muscles a little bit better. For more information about the wand, how to use it, who it's appropriate for, etc., you can head to bn.com.au.